So now we would be discussing the FMG ophthalmology questions that have come in July 2024. If there is any discrepancy in the option or the topic, you can just let me know in the comment section. So first of the question is, which of the following is the ocular manifestation of vitamin A deficiency? Some students are saying that they are asking about some spots. So we all know that these spots are the Bitot spots. So our answer here is very clear. It is Bitot spots which are seen in the vitamin A deficiency. Okay, so let's say this is my cornea and you get some whitish patchy foamy type of lesion, so that are called the Bitot spots. Very easy question. The second question is, which of the following disorders of the lipid metabolism has cherry red spot? Okay, cherry red spot we have studied many times. Basically is the reddish pinkish spot in the center of the retina, and why this happens is because the surrounding retina is pale. Okay, so that's why it is seen in many of the lipid metabolism disorders. Okay, the one which is most important here is the answer, that is the Tay-Sachs disease. Okay, so it can be seen in other conditions as well, like blunt trauma, like in Niemann-Pick disease, but here the Tay-Sachs disease is the answer of choice. The next question is very simple question again. Lish, they have asked about the Lish nodules, and we know the Lish nodules are seen in the neurofibromatosis 1. Okay, so remember, whenever they are talking about the neurofibromatosis 1, that has the Lish nodules, which are the hyperpigmented nodules on the iris, and also we can have optic nerve gliomas, and you can have plexiform neurofibromatosis in the lid part. Okay, so these are the various ocular manifestations. NF2, the answer here is posterior subcapsular cataract. Okay, so that is the ocular manifestation there. Okay, in Sturge-Weber syndrome, you always get a port wine stain, and these patients are more predisposed to have glaucoma as well. And when we are talking about the tuberous sclerosis, the retinal finding here is at astrocytomas. Okay, so these are some important points to remember. So the next question is, a patient presented to the OPD with diminution of vision after blunt trauma. What is the diagnosis here? Very easy question again, previously asked many times. So this is a flower shaped petaloid appearance type of cataract, and we all know that this type of cataract is called rosette cataract. Okay, remember, hypopyon is the pus in anterior chamber, hyphema is blood in anterior chamber, and uveitis is cells and pigments in anterior chamber. Okay, so the next question was, identify the instrument. You can see a wire speculum here. Okay, so this is called a universal wire speculum, and what it does is it basically helps in making the eyeball exposure. Okay, so used in the ocular surgeries for eyeball exposure. Okay, let's move to the next question. A patient presented to the OPD with optic neuropathy and loss of color vision. Very important, these two signs which always point towards the diagnosis of ethambutol induced optic neuropathy. Okay, so very important here is the loss of color vision and the optic neuropathy. Remember, when they talk about the steroids, it is the posterior subcapsular cataract and glaucoma and central serous retinopathy that are the most important ocular manifestation. When we come to the hydroxychloroquine, there is bull's eye maculopathy, you all must be knowing that, and nitrofurantoin can really cause a papilledema. Okay, so these are some important ocular manifestations you should remember. Next question is normal flora of the conjunctiva. We all know the normal flora of the conjunctiva is Staphylococcus epidermidis. Okay, then the next question is this one. So the post-mortem appearance is basically being asked here, and you can see here very clearly that just around the limbus you are getting some hyperpigmentation here. So this is basically called tachynoir. Okay, so this pigmentation which is around the limbus in the sclera hyperpigmented lesions, which are usually seen when the eyes are not closed post-death. So this is the tachynoir. To the last question, which is which of the following is the anesthesia used in the topical cataract surgery? And remember, when they asked about the peribulbar block, the lidocaine and the bupivacaine, they are responsible for the peribulbar block, but here they have asked about the topical cataract surgery. So to topical cataract surgery, we use proparacaine. So here there is analgesia, but there would be movement of the eyeball, so the patient should be attentive. But when you are giving a peribulbar block, it also gives the analgesia as well as akinesia. So these are some important points regarding the FMGE 2024 ophthalmology questions. Please remember, these questions are very important even for the coming NEET PG and the 2 or 3 topics which have been asked, new topics like that are the instruments in ophthalmology as well as the anesthesia in ophthalmology. So all the best. If you have any doubt, you can put it in the comment section, and I would recommend you to join our WhatsApp groups for more practice. All the best. Jai Hind.